hundreds of symptoms have been reported by people who suffer from lingering health problems after a COVID infection. Well, now there's a new study out that identifies a dozen symptoms that could define the condition known as long COVID. Here's a look at the 12 symptoms that were zeroed in by researchers at the National Institutes of Health. They include, for example, ongoing fatigue, brain fog, dizziness, thirst, cough, chest pain, heart palpitations, and a loss of smell or taste. For more, we are joined now by Dr. Chris Pernell. She's a regent at large for the American College of Preventive Medicine. Doctor, thank you for joining us. You see that list there. What do you make of what NIH is now saying?
Blake, it's good information, right? There's still so much we don't know about long COVID. We know that the COVID pandemic was a mass disabling event. It left millions of Americans with disability, but we still didn't understand what the constellation of symptoms were. Different symptoms can show up in different people. We're not quite sure why long COVID develops, whether it's because of an autoimmune issue, whether it's because of an inflammatory response, or because the body is forming clots. So this is much useful information. We won't use it to rule out or rule in someone who may present to their provider with a concern for long COVID, but it will allow us to track people and have answers to future questions and to better be able to treat and manage this disease.
So this is more of a tracking mechanism than anything else, because I was going to say, like, I'm fatigued, I'm thirsty, you know, I might have a cough. Like how do I know? I mean, I could just be tired and need a cup of coffee, right?
I mean, definitely. Look, whenever you see a physician, your provider is thinking about a differential diagnosis, right? What is the most likely cause of what you are presenting with? So this information helps us to understand, one, in those who had previously had a COVID infection, whether it was mild, moderate, or severe, why they may still be experiencing symptoms. And especially because we have a lot of Americans struggling with disabilities and not able to return to their normal activities. So this is good and useful information.
Got it. All right, over to the FDA now. They gave a full approval for the COVID antiviral drug Paxlovid. The pill is for adults who are at high risk of getting COVID. This includes conditions like diabetes, cancer, and weakened immune systems. The approval comes after the FDA first made the drug available back in December of 2021, you might remember, but at that point it was under emergency use. Now, officials say after extensive trials, the drug was proven to be safe and effective. Researchers estimate it could lead to over 1,000 lives saved every week. This is fantastic news, Doctor.
This is exceptional news. As a person almost a year ago who got COVID, unfortunately, and had to use Paxlovid, it's good news because it's an outpatient treatment. It's in a pill form. It's readily accessible. The federal government has stockpiled millions of doses of Paxlovid. And so right now you will not have to pay for Paxlovid should you need it. It is a treatment that a person should take if you're at high risk for severe outcomes, including hospitalization and death, and you need to take it within the first 2 to 5 days of the onset of symptoms. And the last thing I want to say is while it has been fully approved for adults, we still have emergency use authorization in those in the 12 to 17-year-old age group.
Interesting. All right. Dr. Chris Pernell, thanks as always.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.